Welcome to the Hospital Finance Podcast, your go-to source for information and insights that can help you stay ahead of the challenges impacting healthcare finance. And now, the host of the Hospital Finance Podcast, Michael Passanante.
Hi, this is Mike Passanante, and welcome back to the Hospital Finance Podcast. Today, I'm joined by Assemblyman John Bramnick of New Jersey's 21st District, who is the Republican leader in our Assembly. Welcome to the podcast.
Great to be with you.
So let's start out with a few questions. According to the New Jersey Hospital Association, there are now over 811,000 New Jerseyans that have insurance coverage due to Medicaid expansion and through the ACA marketplace. What is the impact to a state like New Jersey should the current formula for Medicaid matching funds change, or if subsidies to insurers in the marketplace would be to be eliminated?
Very difficult. The hospitals need as much support as possible. They have difficulty now balancing their budgets, so consequently it would take the state to try to increase charity care. We could never make up for it. So I think at least the members of Congress that I know want to make sure that we continue to have federal funds so we can support our hospitals. It would be devastating if we lost more funding to the hospitals.
A question for you, which is it's a national issue, but it comes down to the states in a lot of ways. Interstate sale of health insurance. That's a concept that gets discussed with some regularity. My question for you, is that a viable idea for New Jersey? Is that something that could or might result in lower insurance rates and more choice?
Well, there's a few questions built into that. The first is, would it result in lower rates? No question about it. Do you want more choice? Yes. But the product of insurance, and I'm a trial lawyer, is very complicated. Most people cannot read their insurance policy or understand it. So if you had a system, a national system, where you could sell whatever type of insurance you wanted, you'd have to be very careful that those policies at least had some minimum basics within them. So my position would absolutely, I would like broader market. I want competition. But you have to make sure that if someone is buying a catastrophic policy, that it's really a catastrophic policy. Mm-hmm. So if it has a deductible of $100,000 or it pays 30% of fair market value of doctor or hospital reimbursement, it's not insurance. So yes, I think we should broaden the market, but even at the national level, there would have to be some basics that every policy would have to have. Otherwise, it would be very difficult for consumers to really read and understand what their policy is.
And something that's a national issue but close to home is the opioid addiction crisis. And earlier this year, you co-sponsored a bill that Governor Christie subsequently signed designed to reduce access to opioids while increasing treatment options. Can you tell us about that initiative?
Sure. We know that there's a national and state health crisis with respect to addiction. Much of that has come from prescription drugs, and then someone can no longer get the prescription drugs, and then they go to the street to buy dangerous drugs with incredible problems and deaths. So what we did is we limited the ability of doctors to prescribe opiates for a significant period of time. Now, we're going to have to fine-tune this thing, but we surely didn't want a dentist to give a 30-day prescription of opiates for a root canal. And certain doctors we wanted to limit in terms of prescriptions. But once again, that's our first time out of the box. I think we're on the right path, but it's going to need some fine-tuning. So if somebody has major surgery and they end up in the hospital and leave the hospital in their home on a Sunday and they can't get a new prescription, as I said, it has some tinkering we have to do, but generally I think we're on the right path. And also, by putting in a piece of legislation, it opens the discussion as to the problem that exists, that some people for a long period of time didn't recognize as a crisis.
Well, Assemblyman, myriad of issues to deal with. We wish you much luck in the coming new year, and thank you for your service to New Jersey.
Thanks. Great to be with you.
I am joined today by Assemblyman John DiMaio of New Jersey's 23rd District.
Great to be here.
So it's great talking state issues, and of course federal issues touch on us here in the state, as we were talking about offline a second ago. And One of the things we were just touching on was the idea of Medicaid expansion through the ACA marketplace and some of the subsidies that come in, and how a reduction in those subsidies might affect a state like New Jersey, because as we mentioned, that money comes in from the Fed, and if it disappears and if it's become part of your yearly budget planning process, how do you start to fill that gap?
Well, I mean, since Governor Christie opted into the program, money came in, and it's available for use, to help people with healthcare issues. But there's always concern with federal government with any program when they lead with money, and then they start to take the money away or change the amount of money, reduce it, eliminate it, because then that would fall back on our budget at the state level, and that's part of a bigger program, obviously. We're dealing with many departments and costs, so if you have people that are used to receiving, services, and suddenly the rug gets pulled out, that's a concern. But certainly the impacts could be broader than that one department. If we have finite revenue, and we're trying to do other programs, and
Sure.
and costs rise, and we're trying to maintain programs, some take a hit, or depending who the governor may be and the majority party in the legislature, they may decide to raise taxes to do it, which has an impact on all New Jerseyans. So it's a concern. It's a concern because once you get used to it, if it's gone, people are not very happy about losing services. But then at the same time, how do we cover the costs?
Clearly, and offline a few minutes ago, you and I were talking about the opioid addiction crisis, and of course New Jersey is touched on that as well. And we know earlier in the year there was some legislation that the governor signed to help limit access to opioids. How do you think this is playing out in New Jersey?
Well, it's a big problem, Mike. Listen, people are dying every day. I think the number in 2016 was somewhere around 1,700 people died. Nearly 12,000 Narcan deployments. Some for the same person twice in a day. The addiction is unbelievable. It's frightening. It's frightening. And no one's immune from it. As we talked about earlier, there's so many different ways that people enter into this. One of them is opioids, the prescription drugs. And we talked a little bit about someone is in high school athletics, for example, and they go to the doctors and they have some sort of surgery or something that's painful, and the doctor prescribes them 3 pills a day for 30 days. It's 90 pills. And they don't know how to manage that. And one of the things I can tell parents is, listen, that's been limited now, of course, by the law, but even if your child is prescribed an opioid, you manage the dosage. They don't need every pill. I've had surgery myself, spine surgery, very, very painful nerve damage, and I've had them, but I've never taken the prescribed amount because I'm frightened, absolutely frightened. And then we have the other side of this picture where you have young people that go out, but do it. I should say it's not a rite of passage, but it happens. Hanging out with their friends, getting into alcohol, and perhaps marijuana, which is another thing that's moving out there for discussion next year. And they get weakened. Somebody comes along, hey, try this, and it's so small and easy now, and cheap and accessible. Next thing you know, somebody does this, and one time they could be hooked on heroin. And I talk to young people and say, you see your friends dying. Doesn't it scare you? And they go, yeah, it scares us. How does it keep happening? It is awful. Just awful. In fact, if I had my way, New Jersey doesn't have a death penalty, but major traffickers, I think we may want to start thinking about that as an option. Stiffer penalties. You want to play in that high stakes game and make money off the death of our children. We may have something to offer you back if you want to be in that game.
It's insidious.
Oh, frightening. Thank God my children are grown. It's who knows? I mean, again, one bad choice one night. But I think we need to educate. Parents have to know that if your child went out with friends, know who the friends are. If there's anything you don't like about the friends, well, maybe that's the wrong friend.
Yeah.
And so parenting is critical. Prevention with regard to if you have a prescription, manage that prescription, especially for a child, for yourself, not to take the amount that's prescribed,
and dispose of it the right way.
Exactly.
If you're not going to use it.
Well, the police departments do have drug disposal methods now that they can have it incinerated, or there's ways of getting it over. So we don't want it hanging around the cabinets either.
Right.
That's another thing. Kids raid the cabinets. Too bad. I mean, it's awful.
No, it's a terrible problem, and it's certainly gratifying to see that New Jersey took some steps this year to try to alleviate it as much as perhaps government can in these situations.
Government can only do things like limiting. It really starts with great parenting and leadership at home. Be a good role model yourself. Not talking off the cuff about, hey, use these painkillers. It's got to be explained. This can be very addictive and very damaging to the person.
Assemblyman, it's been a pleasure having you on the podcast today. Thanks for all of your insights around these critical issues.
Thanks, Mike.
Thank you.
This concludes today's episode of the Hospital Finance Podcast. For show notes and additional resources to help you protect and enhance revenue at your hospital, visit Bessler.com/podcasts. The Hospital Finance Podcast is a production of Bessler. Smart about revenue, tenacious about results.